All right, good evening, everyone. Welcome. I'm Dr. Sally. Thank you all for joining me this evening for this webinar. Tonight, I'm going to be talking to you about Regenix, what we do as a practice, some of the treatments that we offer, and how these apply to you, the patients. I'm going to take some time at the end to answer some questions. So if you guys have any questions throughout the course of the webinar, just hang on to them, and I will address everything when I'm done. So let's get started. So first things first, what I'm going to kind of show you throughout this webinar, we're going to go through our three-step process. We're going to talk about how these procedures are performed. We're going to talk about what is involved in the procedures. We're going to talk about where we get the cells, and that's both different types of cells, whether it's stem cells or platelets. We're going to talk about how the treatments work and what you can expect leading up to and after the treatments, what these different treatments can help with. And at the end, like I said, I'm going to answer some questions if you guys have any. So to start, I'll introduce myself. I'm Dr. Jess Sally. I am a graduate of the Virginia Tech, Virginia Polytechnic Institute and State University. I went there for both undergraduate and my medical degree as well at the Virginia College of Osteopathic Medicine. My primary specialty for residency, I came back to Pittsburgh and finished my residency at the University of Pittsburgh in physical medicine and rehabilitation, and did a subsequent fellowship in musculoskeletal sports and spine medicine. So I'm board certified in physical medicine and rehab, and also in sports medicine. I'm an avid cyclist and snowboarder as well. So this is our practice. Myself and my two partners, Dr. Mark Adelsheimer on the far left and Dr. Paul Lieber. We are all board certified physical medicine and rehabilitation specialists. We have been part of the Regenix system since 2012. And we've performed quite a number of procedures, as you can see. We treat from beginning to end, both just with the physicians ourselves. You're not getting any treatment from any nurse practitioners, PAs, chiropractors, or any other secondary providers through our system. Our locations, as you can see, our main office is in Pittsburgh and Fox Chapel. We also have some satellite offices around the greater Pittsburgh area that people can be seen in as well. So we have locations that are convenient for most people throughout the southwestern Pennsylvania and tri-state area. So what we know, just based on what we've seen from patients and kind of what we know about the medical system in general, is that there's a little bit of a stopgap when it comes to the continuum of care, from basically the start of people having pain to when people go in for surgery. And what that means is basically people go in, maybe you're seen initially by your PCP, or maybe you're doing a little bit of self-care. Some people will go into the store and just buy some over-the-counter anti-inflammatories or Tylenol or anything else. Sometimes you might be prescribed that as well. Some physicians, whether it's orthopedics or primary care physicians, might also do baseline injections, steroids, hyaluronic acid, some of these other options. There's the next step, which may be going for some physical therapy, some chiropractic care, maybe some additional follow-up with a specialist. And when those kind of treatments fail, then the next step a lot of people take is, well, we have to go for surgery. Basically, Regenix is looking to put an intervention in between your initial primary care and the surgical intervention, with a better option that may be better for you and more suitable for your long-term outcomes. So what we can see from this slide is that a lot of the evidence base for orthopedic surgery is not great. If we look at how orthopedics compare to other surgical procedures in medicine, only about 20% of the procedures that are performed in orthopedic surgery are supported by at least one low risk of bias randomized controlled trial, showing that surgery is actually superior to a non-operative alternative. So what does that mean? It means that surgery is only showing in very small percentages of the situation to be better than something that's non-operative. So if we look at the percentage there, about 53% of orthopedic surgeries in the US have been shown to be ineffective in clinical trials. And that includes things like meniscectomies or meniscus surgeries, some joint replacements, some spine surgeries, a lot of things that we see and hear of on a really routine basis. So when we're looking at this slide, obviously we can see that there's a lot of surgeries that happen in the United States on a yearly basis. And with that surgery, there is a large amount of risk that's tied to it. So we have things like heart attacks, strokes, complications from the surgery, like poor wound healing or nerve damage or other skin damage, scarring, infections, blood clots, and even death. Those surgery risks increase as more surgery is performed or as patients have older age or more complications in general. So what are we trying to do? So surgical orthopedics, we think in the 21st century will not be the dominant form of care. What we're looking to do is replace some of these more invasive procedures with less invasive biologic procedures that can actually help the tissues to heal rather than just cutting things out. And in 95% of meniscus surgeries that are performed, they're just actually removing the meniscus spacer, which is shown to actually speed up the onset of arthritis and actually make things worse. So let's stop cutting things out and let's use these biologic agents that actually come from our own bodies to help with healing and better recovery. So what is Regenexx? Regenexx is a form of something called interventional orthopedics. So that means that we're basically using less invasive techniques to perform the same outcomes as an actual orthopedic surgery. So it's a less invasive new medical specialty. We're using orthobiologics, basically means cells from your own body delivered by injection rather than doing any cutting or sewing or extracting. Much lower risk alternative than surgery, as you could see by the previous slide. In the Regenexx system, this is actually a highly selective physician network. Everybody that provides the Regenexx treatments are physicians throughout the country. We use proprietary patented high dose protocols to extract cells, process cells, and deliver these treatments in a way that's the most effective for the patients. We're a world leader in research and development in the field of orthobiologics, and it's a national self-funded employer-based practice. With the Regenexx treatments, overall, you're going to have less downtime, shorter rehabilitation, which means less length of time in rehab and less painful rehab. Fewer drugs. A lot of times we're actually getting people off of pain medications or off of anti-inflammatories. You're back to work in a few days rather than a few weeks or a few months. And most of the time you're awake throughout these procedures. And you can see in the picture on the left, you know, these treatments are done very minimally invasive. We're talking about Band-Aids for injections rather than big scars and cuts and sutures and a lot of other complicated things. So you can see here from this slide, there are quite a few areas of the body that are treated with Regenexx. And this is actually an abbreviated list. There's more that goes into the Regenexx treatment than just simply what's on this list. But as you can see, most of these pathologies would normally be pathologies that people would go to the orthopedic office for to have surgery or to have some other form of invasive procedure done, where we can do much more minimally invasive treatment to help with this and save you a lot of surgery and downtime. So interventional orthopedics, like I said, basically just means trading off the knife for the needle. So you can think of it in terms of how they went to interventional cardiology, basically meaning that instead of cutting people's chests open and doing open heart surgeries, they're now doing a lot of cardiac-based procedures through cameras that they just filter in through the blood system. So this is very similar. We're using very precise ultrasound or X-ray guidance to actually extract your own cells and then deliver those cells directly to the areas that need treated with reducing pain and improving function. Like I said, either by platelets or your own bone marrow cells. And we're reducing the need for elective surgical orthopedics up to about 70%. So this is an all new medical specialty. This is something that's, like I said, hopefully going to replace the more invasive surgical approach and using less invasive, more focused guidance to help with precise needle placement and doing these procedures in a much more minimally invasive fashion. This is kind of the picture of a typical setup of what you would see in our office or in any clinic that's doing this type of work. We have our X-ray machine, something called the C-arm. It looks like a C, and then our ultrasound machine, both of which we use. The patients are placed on these tables, usually very comfortably. And the setting to kind of have these procedures done, obviously, is we try to make it as comfortable and as nice of a environment as possible for you. So it reduces stress and just helps make it a much better experience overall. All of our processing is done by hand. This is a picture of our one of our hooded labs. As you can see, these labs are very high tech. This is the same type of a laboratory or hood setting that you would find in an academic institution or professional institution that's performing any type of cell handling. All of our blood processing is done by hand by our trained technicians, and everything stays in our office, so we're not using any third party for any cell processing, and your cells never leave the building. So we go from more high volumes of blood draws into more minute volumes of very concentrated cells. These are two syringes containing platelets from a patient's blood draw. As you can see, we take out all of the cells and all of the unnecessary elements like red blood cells and white blood cells, things that make blood the color that you would normally see. But these are the nutrients and the growth factors and the platelets within the blood system that help with healing and actually help with promoting tissue regeneration and better joint health. So what are some examples of interventional orthopedics? Different types of procedures for different joints. When we're talking about the knee, one thing is our actual ability to help with healing complete ACL tears. So when the ACL, which is a main stabilizing ligament of the knee joint, tears, we can use X-ray guidance or ultrasound guidance to help with actually injecting these cells directly into the ACL ligaments and actually healing these ligaments, which normally would require a complete orthopedic repair and reconstruction. This is a picture of, a shoulder injection, more specifically in the top part of that shoulder where we actually inject something called the labrum, which is a piece of cartilage that supports the top part of the shoulder that's very commonly torn. You might be able to see in this X-ray image, this is kind of a time-lapse picture, but it takes a very precise guidance to actually inject that contrast into that area of the labrum and place those cells very specifically in that area. We have very high training that allows us to do these same types of procedures in our office for patients with labral tears and shoulder arthritis. This is a picture of what a procedure for like arthritis in the kneecap might look like. This is actually a picture of us injecting stem cells into both the bone and the joint behind the kneecap. So this helps with more severe arthritis and bone deterioration that happens when people have more advanced arthritis and more advanced bone damage or cartilage damage as a result of that. This is us injecting platelet growth factors around the median nerve, which is the nerve that's responsible for carpal tunnel syndrome. So instead of going in and actually snipping the carpal tunnel and releasing that ligament that you need for wrist stabilization, we're actually injecting those platelet-derived growth factors directly around the nerve using a very small gauge needle and spreading that growth and healing factor right around the area where that inflammation is happening and causing the symptoms related to the carpal tunnel symptom or carpal tunnel syndrome without surgery. This is an image of a before and after of a rotator cuff injection with the patient's bone marrow concentrate. Obviously on the left, you can see there's a large gap indicated by that red arrow where there's a large rotator cuff tear in the top of the rotator cuff. And you can see the joint fluid kind of spilling out around the joint. That's that bright white fluid. On the right, you can see where that the rotator cuff has regrown and repaired. That joint fluid is now contained in the joint, and there's good tissue that's helping to keep that joint stable and help that rotator cuff muscle and tendon to regrow and reattach. This is an actual picture of a woman who had her procedure done here in Pittsburgh. She had something called avascular necrosis of the knee. You can actually see her video online on our Regenx website, but she had bone marrow stem cells that were actually placed into the bone to help heal an area of the bone that was actually dying from a lack of a blood supply. And you can see between March of 2014 and September of 2015, that area of bone has significantly healed, and she has had significant pain relief over time, and she's still doing very, very well to this day. So when we talk about how regenerative medicine actually works, when we talk about PRP or platelet-based treatments, platelets have growth factors in them that actually help to amplify healing. So PRP, the platelets themselves are kind of like the espresso shots for local repair cells. So they actually organize those cell processes and make them work harder and longer to help with decreasing inflammation, healing tissues, and helping to basically just keep that good, what we call homeostasis, or good balance of the joint working for extended periods of time. Stem cells work actually as more the general contractors for the repair job. So they actually tell cells what to do, and they actually become the tissue that actually helps to rebuild the joint or the bone or the muscle or the tendon that's damaged. They can also act as the signals to help with other growth factors, and they basically become the bricks and mortar to help with repairing damaged tissue, as I said. So your own cells, it can help with, like I said, joint pain, inflammation, tendon tears, arthritis. PRP, when we're talking about blood draws, we're talking about just doing a blood draw similar to what you would have done at your PCP's office. The blood is extracted in small tubes, and we use a centrifuge to help to spin that down. That's what we use for more, I would say, mild to moderate arthritis, tendon tears, long-standing tendon pain, and a plethora of other things that we use in the office. Stem cells are more geared toward more extensive arthritis. I have a lot of people who talk about, I have this bone-on-bone knee pain, and they said surgery is my only option. And that's pretty much every patient that comes into our office. A lot of the patients that we're treating with more extensive arthritis, those are the ones that we're using the stem cells for, and they're getting great results from it. So again, we want to use the right medicine for the job. So we're looking for, we're looking at your situation individually. What do we think can be done? What do we think needs to be done? And we're choosing the right concentrations. We're choosing the right dosage. We're making sure that those cells have good viability, and we're doing the treatments on the same day so we don't lose that viability over time. 50% of what we do in the practice is PRP. And like I said, there are certain instances where PRP might be helpful. Stem cell treatments might be better. We take that on an individual basis, and we'll let you know what we think it can help, what it can't help. And we'll talk through that in the course of our meetings. So PRP, like I said, usually more for smaller joints, less severity of arthritis, ligament damage and joint laxity responds very well to PRP. Tendons and also the spine is primarily treated with platelet-based treatments as well. Bone marrow concentrate is usually used more for larger joints, more extensive damage. Like I said, that more bone-on-bone type arthritic change. Higher severity, and we also use stem cells to actually treat the bone itself if there is destruction that's happening below the joint surface in the actual bone tissue. So like I said, about 50% of what we do is platelet based, and about 50% of what we do is stem cell and platelet based. There's a significant cost difference between the two, but not everyone needs stem cells. We also take that on an individual basis. So with these injections, there's actually 3 different steps that happen with the bone marrow or the stem cell injections. And each one of those treatments is a little bit different. So when we're talking about the first injection, we refer to this as the pre-injection. It's basically tilling the soil. So what we're doing is we're stimulating some inflammation in the joint to help to rally your body's normal immune response to the area. And what this does is it's not going to be an inflammation that you're really going to notice or feel. It's just going to be something that's going to be a signal in your body to say, hey, there's an issue that's happening here. We need the body to kind of focus on this. And that's going to help your healing response to be better focused on the treatment and how you respond to it afterward. This is how the stem cell injection takes full advantage of your body's own natural healing response as well. So we actually take the bone marrow concentrate from your own bone, your own source of your stem cells. We take it from the backside of the pelvic area. It's an area outside of the hip joint, so we're away from the hip, and we're also well away from the spine. So any issues with spine surgeries or prior hip surgeries or anything like that, that's not really anything that we have to worry about. Those stem cells, like I said, are taken out, concentrated on site in our laboratory, like I said, and then re-injected back into the damaged area on the same day. And after that, you go home. There's no overnight stays. The recovery is very minimal, and it's very easy to tolerate and recover from. So injecting the stem cells is actually what we consider planting the seeds. So the first step is tilling the soil, getting the joint ready. The second step is planting the seeds. You're usually doing this 2 to 4 days after we do that initial injection. The bone marrow aspiration happens, like I said, from that area on the backside of the pelvic bone. Usually patients rate that aspiration pain as about a 3 or 4 out of 10 on the pain scale. So it's not too bad for patients. We use a lot of anesthetic when we're doing those draws, so people don't find it too uncomfortable. And there's not a lot of pain that people experience after the procedure as well. We take that sample for lab processing. That usually takes anywhere between 3 and 4 hours. And then we re-inject that solution later on in the day after that time has passed. The last injection in that series of 3 is another platelet injection, and this is the fertilizer. Platelets are like Miracle-Gro for stem cells. So again, this happens about 2 to 4 days after we do that stem cell injection on the second day. This will come from a blood draw from the arm, just like a normal platelet procedure would. We process in the lab. It takes about an hour and a half to 2 hours, something like that. And then we re-inject, and again, you go home that same day. So when we talk about research, we have one of the nation's largest registries of patients being followed for these treatments. And these treatments, or these patients that are being followed, are not patients that we've just taken and cherry-picked good results. These are patients that sign up for the registry from the time of their initial consult and from the time of initiation of the treatment. And we follow them all the way through their treatment, their recovery, and then for years after the treatment. Right now, there's over 34,000 patients that are actually involved in this registry. 29 peer-reviewed papers have been published as a result of our data and data that has come out of the REGENX headquarters. There's ongoing research and randomized controlled trials that are still being done and are in process right now. And we're using these as outcome tools to kind of see what's possible. But these different this different research that we do within the REGENX community also helps us to ongoingly improve our treatments and our treatment options, and to help optimize the different options that we're giving to you and how we perform these procedures. We have the world's largest safety paper on these types of treatments right now, basically showing that there's a large body of evidence that these stem cell procedures are safe for treating orthopedic conditions. Very minimal complications, very minimal pain for patients. Basically, the biggest complaint from patients was just pain at the injection site. So basically what we're trying to do is stack the deck in your favor. We're using physician-only practices, so we're not using any secondary providers. It's the doctors that are very highly trained, highly specialized, and very additionally trained in these types of treatments and how to administer these treatments effectively. We're using imaging, so there's no guesswork in what we do. I'm not guessing where I'm putting that needle. I'm using ultrasound, I'm using x-ray guidance, I'm using tools that are going to help me get these cells directly to the area that's problematic for you, because that's what's ultimately going to give us the best outcomes and the best pain relief. We have the largest amount of research, and we're basically providing you with a large amount of safety data so that you have a good peace of mind that what you're getting is going to be the best, it's going to work, and it's going to keep you safe. All of our treatments are very personalized. Like I said, we're going to see you in the office. We're going to spend a lot of time going over your story and talking about what we can do. And everybody's like a snowflake. So all of these different treatments might be different for different people. We take your individual story and your individual problems, and we tailor the treatment directly for you. Evaluation and candidacy, like I said, we go through the process of evaluating you. We spend about an hour with everybody, going over history, going over imaging, doing some imaging of our own in the office, and establishing what we think, how you are as a candidate for these treatments, meaning, do we feel like these treatments are going to work for you? What type of treatment is going to be the best for you, and how we organize doing these treatments and making them work for you. And there's also a lot of transparency. We go over cost, we go over what we think the outcomes are going to be, we go over what we think your rehab is going to be like, how long we think things are going to be effective, or how long your recovery is going to be. So there are a lot of different ways that we try to approach these treatments and give you all the information that you're going to need to make sure that you feel confident about the treatment that you're getting. So who's this for? Basically, I say that these types of treatments are for everybody. But mainly it's for people that want to avoid surgery, either because you maybe just don't want surgery, you could be too young for surgery, maybe, surgery is not something that you want to go through, or you don't want to be off of work for that long. There's all sorts of different reasons that people don't want surgery. Maybe you just don't want the pain. So this is an option for people that want to stay away from the OR table. You want to keep all your parts. Some people don't want metal in their body. Some people don't want things removed or other things replaced. So, we're giving you the option to use your own body to help your own areas heal and recover. Like I said, no lengthy downtime, no lengthy rehab. People don't want to spend a lot of time in physical therapy, and I understand that it is important, but we want to try to reduce the need for that as much as possible. People don't want drugs. People don't want to be on pain medication. They don't want to have to, worry about taking that or how it's going to affect your day-to-day life. So, we're looking to reduce medications as much as possible. Maybe you've had treatment or surgery before and you don't want to go through that again. We have plenty of patients that come in and have had surgery on one side or one knee or one shoulder, and they don't want to go through that again. And we end up treating the other side and they do much better, much faster. So ultimately, we're looking to help to get your life back. People want to be involved with their family. They want to have fun. They want to do the things that they want to do. They want to have stable finances, which means either getting back to work early or not being out of work for a long time, or minimizing rehab or minimizing complications that might happen with hospitalization and all of these other things. We want people to get back to, physical fitness and health. And just have better relationships because you're happy and you feel good and you want to be out and be with your friends or be with your loved ones or be with your family. And that's really important to us. And that's what we want to try to promote for people. So again, results, we're looking for good outcomes, less pain, improved function, improved mood because you feel better. You're off of pain medications, which again is going to help you to feel better. And it's also going to have less negative effects on your health and your body in general. And you're back to your preferred, active lifestyle, whether that's gardening or, just even going out for short walks or just playing with your grandkids, or, maybe you're a pickleball activist, or all sorts of different things that people are into that they want to try to get back to and stay active with, of all different levels and capabilities. So we're looking, if you want to get there, we're going to try to get you there. So what are the next steps for you? To see us, you don't need a referral. You can come in and just make an appointment with us. If for some reason there are a few insurances that may need a referral, we're going to let you know and we'll take care of that. So just give us a call. We'll find all that out. Gather imaging. If you have old imaging, fine, bring it. If you don't, that's okay. That's not going to be a problem. We can order stuff if we need to. Call the Regenx liaison. Talk to them at the office and help them to get you on the schedule, and they'll guide you with everything that you need. We can go, we prefer in-person appointments. We are doing some telemedicine work now that COVID has been back more prominent, but it's better for us if we can see you in the clinic and put hands on you and actually go through some imaging of our own and work through some of the problems that we can help to get you the best treatment possible. And our office is a COVID safety zone. Everybody, all the staff members are fully vaccinated. We're taking all the precautions. We're keeping all the work areas clean and making sure that it's safe for everybody that comes in and all of our patients. If you're a candidate, we'll talk about the different types of treatments. We'll talk about the rehabilitation and at home or at physical therapy, and we'll just help you get back to your life. So like I said, step one, make an appointment. We're local. Like I said, we have offices sort of all around the Pittsburgh area to be able to see you and talk about these different treatments. And we're going to do our best to get you in there and tell you what you need. Like I said, we do an extended exam. We look at the whole body. We don't just look at, the area that we're looking to treat. We also look at, is there something else that can be affecting this? If it's a knee, how's the ankle look? How's the hip look? How's the back look? We'll do an ultrasound exam in the clinic if we want to, answer more questions about ligaments and tendons and different parts of the joint that we can see that way. And you'll get all your questions answered. We have more time to sit down and be a little more personal about your specific issues, and we can talk through some of the questions that you might have for your specific case. Little to no rehab, like I said, minimal to no pain medication. There's some soreness initially after the procedure that we just try to keep people comfortable with, but nothing really after that. Most people get away with just taking Tylenol. Little to no downtime after that, minimal missed time at work. You're back to your life quicker and you're back to what you want to do quicker. You don't want to put your health on hold. You want to avoid surgery backlog, and you want to avoid worsening of your condition. So you don't want to wait and risk anything getting worse. The faster we can get you back to activity, the faster you can get back to getting stronger and getting your fitness back and getting your health back. And we're basically just looking to get this done for you as quickly as possible so you can get back to your general health as fast as possible. As far as finances, we'll talk about this more in the evaluations, and we'll base it a little more on your specific treatments individually. All of your consultations with us, follow-ups, any diagnostics or imaging that we need to order, any bracing that you might need, post-treatment therapy, all of these things are covered by your insurance. The only thing that insurance does not cover is the regenerative procedures themselves. So whether it's prolotherapy or the PRP or platelet-based treatments or stem cells. But if you look at the comparison between these treatments and what it might cost you out of pocket for a traditional orthopedic surgery, after deductibles and after the extensive amount of rehab, you might be paying more going with the orthopedic surgery anyway, just because of the amount of time afterwards that you're looking at rehab, or just from copays from the surgery themselves. So next steps for you, best thing to do is to call and schedule a new patient exam. You can contact our office or our Regenexx liaison, Sarah Ferland, to establish an in-house consultation, and we will get you set up with an appointment as soon as we can. So again, avoiding surgery, reducing downtime, and getting you back to life. And that's the overall of it. What I'm going to do now is I'm going to take some questions from you guys. I hope that I was able to answer a lot of your questions and give you some good information with what I talked about today. But if you guys have any other burning questions, chime in here in our question and answer session. I'll review it here, and I'll look over what everybody is asking. Can Regenexx be used to speed healing in the middle joint of the pinky? That's a very specific question. Yes, it depends on the extent of what we're dealing with. Swan neck deformities are usually more of a ligament damage deformity. It depends on the case. It depends on so a couple other different factors. So that's something that we would have to talk about more specifically in a direct visit. Next question, can the treatment help a Baker cyst? And that's a very common question. Yes, Baker cysts are usually fluid that collect in the knee, usually in the backside of the knee, as a result of inflammation from arthritis. We drain Baker cysts quite a bit, and there are some treatments that we can do to try to reduce the risk of recurrence of those Baker cysts. But most of the time, just decreasing and treating the actual knee joint helps to alleviate and prevent the recurrence of a Baker cyst in the future. So yes, we treat those very commonly. Helix rigidus treatment options, yes, we treat that often. It depends on the extent of it. I usually treat small joint issues with platelets, but again, that's something that we could take in course with our consultation. But yes, it is something that we treat. Good questions, guys. If anything else, keep it coming. If you had meniscus surgery and now have osteoarthritis in your knee, is the process successful? Yes. You are the type of patient that we see in our practice all the time. And yes, these treatments are very successful in people that have arthritis as a result of prior meniscus surgery. Success rate of bone on bone in the knee, it's high. Like I said throughout this presentation, bone on bone arthritis in the knee is the reason most people are sitting in the seat across from us. We do these types of treatments on patients with bone on bone arthritis all the time. That's the large majority of the people that we see with knee or shoulder or hip arthritis. And the success rate's very high. I'd say probably, and it depends on the patient. It depends on a lot of other different factors, but I'd say, 70% on average across the board. How long must one wait for another bone marrow aspirate draw? I had one in Texas 1.5 years ago with a scope, and I guess the basic answer to that question, that's again very specific. We can do bone marrow draws very quickly. Usually I have patients wait, only about 6 weeks if we're going to be doing another treatment for people. Like let's say we treat one area and we want to treat another area. Usually I have patients wait about 6 weeks to get appropriate bone healing and stem cell regeneration. But it's not something that we have to wait an extended period of time for. Usually I say about 3 months to make sure that we have good recovery from the first area that we treat, but certainly 1.5 years, that's plenty of time for to be able to do another bone marrow draw. How long does it take to see results? It varies patient to patient, but I would say typically, people start to feel some improvements over the course of the first few days to the first few weeks. The first month with patients is usually what I call the roller coaster month. Some people improve really quickly within that month. Some people, it takes a little more slower upswing to see improvements. I'd say somewhere between the 3rd and 6th month is where people start to see the most improvement, but people are usually noticing improvements before that, and it's more of a steady upswing in terms of people's relief from the time of procedure. So, but it's not like a steroid injection where people see results within a few days. It doesn't work like that. It's a healing process. So it still does have to take time for patients to recover after these treatments and to notice that healing. But again, it's not like you're down for that extended period of time where you're recovering more aggressively, like after surgery, where there's more pain and more joint limitations and more recovery that you have to do that way. This, you're back to baseline or better within the first few days after the treatments, and then the healing just kind of continues from there. Good questions, guys. These are very good questions. What else do you guys have? Anything? Would you be able to mountain bike immediately after the treatment? Usually I have people, usually for more high level activity like mountain biking or aggressive hiking or cycling or running or a lot of these things, I usually, I take it on a case by case basis, because mountain biking is a very aggressive activity. As far as like just being on a stationary bike, because that's not as aggressive, I usually have people even start that within a few days after their treatment. But I would say for more intense activity like mountain biking and being outside, I would maybe wait a little while just for the sake of going through some recovery and being able to feel comfortable and good range of motion and less pain going out there and doing something high level like that. So I try to get people back to activity like that as fast as possible. And like I said, even having people back on a stationary bike within a couple of days after the treatment and kind of moving forward from there. What else? You guys are doing great here. Any other burning questions right now? If not, that's great. I appreciate everything that's coming through. Hopefully, you guys, Karen, you don't have to raise your hand. Just go ahead and ask if you have a question. But I'll wait and see if anybody else chimes in here on a couple more questions. You guys can just go ahead and ask your questions right in the question section if you have questions. There we go. Do you ever use any third-party products like amniotic fluid or just your own bone marrow? Yeah, we only use your own bone marrow. We never use amniotic fluid. We never use umbilical products. We never use exosomes. There's been no research that's actually shown that any of those products contain any live stem cells that contribute to your healing. But what we do know is that your own bone marrow stem cells are effective and do provide good healing even into advanced stage. And they work very well. The way we process the cells gives you the most viability of those cells and the highest concentrations to be able to give you the most effective outcomes possible. Again, Dawn, can you do treatment on both knees at the same time? So that's a good question. The answer to that is usually no. However, I can do treatments at the same time. Usually what I'll do for patients is because we're concentrating these bone marrow cells and we're trying to be as effective as we possibly can with treating the joints that are in question. Usually what I'll do is I'll treat the area that's the worst effectively with what we need. And it kind of depends on what we're using too. If we're using stem cells, sometimes it gets difficult to treat both knees at the same time with stem cells, but I can treat both knees at the same time with platelets. I can do that effectively. And I can do treatments of maybe the less affected joint with platelets at the same time that we do stem cells for the more affected knee. So, but with stem cells, that gets a little bit tricky because you're trying to treat as much as you can with what you get. And so that's why it's a little bit difficult to do that at the same time with both areas. Does the procedure need repeated? And if so, what determines such? Sometimes there are procedures that need repeated. It's very rare. It would depend on if there's still issues with pain, if there's still issues, and sometimes patients will have issues after the treatments that may not be directly related to, like, say, if we're treating knees, pain after that might be geared more toward like tendon related pain, things that we can treat that aren't directly related to the joint itself. So we typically take that and follow up and sort of look at the patient's individual pathology and problems, and we try to treat based on what we still think is going on more directly. does the treatment help to prevent fluid buildup in the knee? Yes. People that have routine swelling and pain, a lot of times that swelling typically will resolve steadily after the treatment. And people usually have less swelling and less fluid buildup as time goes on and as they heal and recover. These are, again, great questions, guys. You guys are really, really thinking through this and providing me with some good questions. If anybody else has any questions, I'll take them now. If not, I hope that you guys, learned something from this presentation. I hope that you got something out of it. Hopefully, if you do have issues, you'll give us a call, make an appointment. I'd love to see you in the clinic. I'd love to help you guys out with anything that I possibly can, get you back to the, less pain and better active lifestyle as best as we can and as fast as we can. Like I said, give our office a call, 412-963-6480. We'll be happy to get you in for an appointment and we can talk more. I really appreciate you guys being on here tonight. Like I said, you guys asked great questions. I think there's a lot that we can do for you. So give us a call, make an appointment, and hopefully we'll talk to some of you soon. Otherwise, Happy New Year. Have a great night. Thanks again for tuning in, and be well. Thank you.